welcome back to the Morning Blend. Get back in the game. Whether you need hip, knee replacement, or are recovering from surgery, the care you receive is crucial.
That's right. For over a decade, our next guest has specialized in helping you. And here to tell us about his 5-star treatment and outpatient recovery center is Dr. Michael Crovetti. He is the founder of Crovetti orthopedics, in sports medicine and the Outpatient Surgical Recovery Suites. Sir, it's a pleasure. Thank you so much for joining us.
Thank you.
So let's talk about this. You're a board-certified orthopedic surgeon. What are the common problems you see coming through into your office?
Most of my practice has been hip, knee, and shoulder surgery. So everything from the young athlete all the way up to the hip and knee replacements.
And those are pretty common surgeries, especially as you get older, things tend to wear down, and so obviously they need to be repaired.
Well, you think about the baby boomer generation. So now they're 67, 68, you know, all the way down to in their 50s. Well, think how active they've been.
Yeah.
So hip and knee replacement specifically has really become popular. Better implants, younger patients, healthier, want to get back to their lives. So that's why we're here today.
So what's the difference between outpatient hip and knee replacement as opposed to the traditional way of doing things?
You know, I've been in town 14 years and done thousands of hip and knee replacements, and I've always done them at St. Rose Hospital down in Henderson. Wonderful hospital, wonderful people. But you know, as the patients changed a little bit, maybe they don't need to be in a hospital. So the outpatient model works with the surgery center, so it doesn't expose them to some of the things in the hospital that you might think of. So the surgery center, we do it there, and then they stay in kind of a rock star recovery suite afterwards where we totally focus on them.
Some people get very anxious.
It's a very beautiful center, very calming and very relaxing. So as Sean was just about to say, I think it's just calming and peaceful for people to recover there. And you have physical therapy as well.
As opposed to a hospital where people can kind of clam up, you're like, oh, it's a hospital,
You know, unfortunately, a lot of people become afraid of hospitals, and they're not that bad, but they have become afraid of them over the years. And around the country, they do these hip and knee replacements, and sometimes they'll send the patient to a hotel. Well, I wasn't real comfortable with that, so I came up with kind of a hotel in my office where we have nurses there 24 hours a day, physical therapy all day, 5-star meals, you know, all the things that maybe you don't feel like you're sick.
Can I book a room at least? Is that possible?
You're not the first person to ask that.
So you also help shoulder problems as well, right?
I do, and shoulders have become just as popular as hips and knees, and getting more popular because of all the athletics. You know, there's lots of people out throwing balls on weekends and hitting tennis balls, playing racquetball. Squash is huge. You know, a lot of racket sports. So shoulders are super popular right now.
And at what point do you know you need surgery? Because a lot of people probably mask their pain with medicines and over-the-counter drugs, and obviously that doesn't help them. At a certain point, they just give up.
Everybody tries to stay away from the doctor, right? So you go when you've tried some other things. You've tried the Advil, the Aleve, the Motrins. You've tried them. And then you'll come see us, and then we try things. So the goal is to keep you out of surgery always, as hard as that may be to believe. We try and keep you out of an operation. So injections, physical therapy, and time. Often that'll do it just as well.
So you open these recovery suites, people have got to be blown away by them, and let's talk about their reactions to it and their outcomes.
Yeah, and we just actually published our first 350 patients, and amazing. You know, all the things you worry about in hip and knee replacement, infection, you worry about blood clots, all these things. We had one infection in a patient who had an infection that we didn't know about prior to surgery, and we've had no blood clots. Everybody's up. Within 3 hours of surgery, you're up and walking after a knee or hip replacement. It's pretty amazing. They walk over 2,500 feet in 2 days.
Wow.
Whereas traditionally they may have walked 200 in the hospital setting. Pretty amazing.
And over the years, how many people do you think you've helped here in the Valley?
I think last November we actually did our 14,000th surgery.
No kidding.
Yeah, pretty neat. Pretty neat.
So this seems to be the future of this type of care.
I think so. I think as that generation comes up, continues to stay active, our implants, what we're putting in people, has gotten so much better. So these are more high-performance implants. We're using minimally invasive techniques, little incisions, very little muscle injury. So these patients can get up and move right away and get walking right away. So the future of that is going to be better implants, more active patients, outpatient environment, and getting back in their game game a little quicker.
And obviously physical therapy is very important for some people to recover. So you could give them the best surgery ever, but they really also need to do the physical therapy portion of their recovery.
Yeah, as we study these patients, one of the things that we found, they're mentally committed. We have health surveys that we give before and after. They're mentally committed to the procedure, and that includes physical therapy, and they get fired up and excited about getting their knee better, getting their hip better. It's really pretty awesome.
Well, Doctor, it's a pleasure. Thank you so much for joining us.
Thank you for having me today.
Thank you.
I actually look forward to having a hip replacement now if I get to stay in one of those rooms. Again, Dr. Crovetti is a board-certified orthopedic surgeon. He is the founder of the Crovetti Orthopedics and Sports Medicine and the Outpatient Surgical Recovery Suites. If you want more information, call the number or go to the website on your screen. They're also on Facebook.